Someone asked in the comments how pericarditis is diagnosed. Basically, you would be going either, most people go to the emergency room because the pain is intense, but some people may end up going to the cardiologist's office if the pain is not as intense. And they would do testing, including blood work, a chest x ray, an echocardiogram, and an EKG. And then, there's some classic symptoms or signs of pericarditis. And one is that the chest pain is pleuritic and positional. So that means that the intensity and quality of the chest pain changes when you take deep breaths or when you change position. So that means it's different versus when you're lying down versus sitting up or leaning forward. And then a lot of times when the provider or doctor listens to you, they would hear a pericardial friction rub, although that's less common. And then the EKG may show ST segment changes that are classic for pericarditis. And the echocardiogram may show that you have a new or worse pericardial effusion, and that's fluid in the sac around the heart. Now, it's normal to have a little bit of fluid, but if there's a lot more fluid, then that would be concerning for pericarditis as well. And you may need additional tests. Like I mentioned before, there are a lot of different causes for pericarditis. And so you may need tests looking for what infection you may have or autoimmune disorder that could cause pericarditis. There's a really long list of what could cause it. And so they may do additional testing if it's not very clear from your history why you might have gotten pericarditis. And then people may also need cardiac CT or MRI to look further at, the inflammation in their heart. And some people need a pericardiocentesis, and that's when a needle is put into your chest and the fluid around the heart is pulled out so that they can send that for testing, just depending on what all is going on with your case specifically.